Welcome to the office. Okay, so we're going to go ahead and do instrumentation first. And the major complaints here are double vision in the right eye, correct?
Correct.
And the right knee.
Correct.
Those are the two major issues. And as I'm going along this, I may ask you a couple of things, okay? So what's interesting about this case is, he had a couple of traumas, construction, right, on site, and hit his hard hat hit here, and after that created some sort of double vision, correct?
Correct.
Yeah. And so he's telling the other people he had seen prior to coming here, regardless of the discipline, says when he flexes his head to the left, his double vision is gone. Is that correct?
That's correct.
Okay, but no one paid attention to that. That's what's a little weird. Now, we're gonna go ahead and run the instrument. We're getting a big reading, top right. Base of the neck on the left. T5, T6 on the left. And then we were getting a reading down at L5 on the left, okay? Now, next thing we're gonna do is static palpation. As we're statically palpating, you can also see he has some dishing in the spine. Dishing usually meaning the curvature of the thoracic spine is indenting. It should be coming out more, okay? And that usually starts around T7, T6, T7 dramatically. Changes in skin, T6, point tenderness, pain there, more there. Got it. You can see a loss of curve, and what we talked about is, so he has two separate traumas. One trauma was the hard hat hit here, jolted his neck. Second one is the boot got caught, twisted the knee and the pelvis. So just looking at the spine now, you can see there's a loss of the normal lumbar curve. You can see the right glute is slightly smaller than the left. And we talked about a potential ilium issue going on here. So we did get a reading down at L5. We do know L5's got some point tenderness and swelling. What's interesting here is I want you to notice this, because this is going to be a marker for us down the road, okay? This is going to disappear. And you're gonna get the curve, okay? If that's what our goal is.
Yes.
Okay, if that's our goal. We've had several patients like that. They had this, you can see the creases higher here than here. All of this points to an ilium subluxation or ilium issue. Now, when we scoot forward, we're gonna have him open and close the knees, butterfly effect. Left side only. Now when he does the left, you can see the right goes with it. Do the right side only, but when he does the right, the left tissue's moving, but the joint's not. It's fine, okay? Now, when we're looking and statically palpating, this is the top of the joint. Middle is tender and bottom is tender. When we motion it, we're finding fixation middle to the bottom part of the joint, and that's consistent with an AS ilium. When we do the left side, no issue. You feel the difference there, sir?
Yeah, I do.
Okay. Right ilium, L5, T6. Now, here's what's interesting. Let's go to the front. Here's what's interesting. We know there's a pelvis. We know L5. We'll decide on that. But here's what's interesting in this case is this double vision of the eye. He laterally flexes away. So if he laterally flexes away, the double vision feels better or is gone.
It's gone.
Now, when we were testing something out, I'm putting my finger here, it also felt a little bit better. The other symptom or issue is weakness here at the inside of the wrist or along the ulnar distribution, ulnar nerve distribution, ulnaris muscle groups, along with the ulna. And just feeling the ulna, you can feel ulna is out a little bit, but so is the trapezium. Sorry, not trapezium, pisiform. Okay? But all that starts back here. Okay, now we try to differentiate between upper cervical and lower cervical. We're doing divorce test. This is what was a little misleading, but it's fine. Let's go into flexion. Flexion, we're isolating the upper cervicals. We're gonna rotate left and right. And he's actually fine doing that. Right, sir?
Yes.
Okay. Go back into extension, turn left, no problem. But watch what happens when I go right.
You feel it on top.
He's feeling it up top here. Okay? So we do have 2 nerve pressure readings, but based on this test, we're gonna go after C7 and then recheck all of this. C7, right pelvis is where I wanna start along with your 5th lumbar.
Okay.
How's that sound?
That's perfect.
All right. Let's walk and watch his walk, please. So it was nice that he also mentioned and noticed the external foot flare. Look straight ahead, please, when you're walking. Yep, turn around, keep going. And you can see the external foot flare. Now what I'd like you to do is march in place. Take a couple of steps forward though, right there. March in place. Nod your head up and down. Keep your eyes closed, I'm right here. Keep nodding your head up and down, please. I'm right here. Stop marching, keep nodding your head up and down. Don't stop the nodding, please. With your eyes closed, I want you to stop to where you feel your head is level. Stop where you feel level, and now open your eyes. And there it is. You can see high on that right side. But here's what's interesting. Here's what's interesting. It starts to curve here. So the whole, it's a very subtle arc that does this. Follow my finger. It's a very subtle arc.
I want to add one more thing to that. Too.
Yes, please.
My balance is off.
Your balance is off.
Ever since that head injury, I noticed that my balance, if I close my eyes, like right now marching in place, I can feel like.
You're going off balance. Okay, not a problem. Can I have you stand right over here and face me, please? March in place again. Yeah, so a lot of right rotation. There is the knee. Today, like I said, what we'll do is we'll focus on pelvis, C7. We'll have you walk, we'll retest everything after and see what we're gonna do from there.
All right.
Okay, let's do it. Have a seat. C7 we're setting as a PR. And then we'll have him walk after that. There we go. Let me do the work. Feet out, please. There you go. And I want you to notice, watch his feet for a second, okay? Whenever we're doing cervical chair, typically we want to be mindful of those feet. And Dr. Gonstead used to talk a lot about it, that when the feet are extended, it really does relax the spine compared to keeping them bent or crossed. There we go. Okay. Nice and easy. He actually does have a lot of flexibility in his neck. Down. There it is. Home run. Sit up straight for me, please. Now, what we just did there, squeeze my hand and tell me about that ulna side.
So just a little bit.
Is it different at all?
Yeah.
Walk it off once, please. Can you tilt your head to that side and try to cause double vision?
Let's try. Still there a little bit.
Is it different at all?
Double vision is still there, straight ahead. If I try to, if I turn my head to the left,
It's gone, right? Okay. Have a seat, please, over here. I'm gonna get a little more of C7, okay? All right. A little bit more. There it is. There you go. Gotcha. Okay. Let's go over here, please. We're gonna go on knee chest. We're gonna do L5. Bring that left knee back a little bit. There it is. Nope. Go ahead and square yourself up so you feel balanced. There you go. Belly button down. Belly button up. Belly button down. There it is. Gotcha.
Wow.
Have you had that before?
No.
Come on up slowly, sir. Come up, walk it off. Good stuff. What?
No, I've never had that.
That's set really deep.
Wow.
His walk is a little different already. Watch his feet. Look at your feet, dude.
Yeah.
It's different. We didn't get to the pelvis yet.
Rush to the head.
Okay, keep walking. Keep walking. Cool. Have a seat. See the difference now? Look at the difference even there. This is already less. Pretty cool. Let's see if we need to do the neck. 7 is clear, my friend. 6 is there, though. Let's go. Let's go on the orange table. 4, 5, 6. Drop the hands down to the floor. There you go. Chin up. T6, PL pass. Drop the hands down. There you go. Watch him walk. Watch his feet, please. Take a nice deep breath in. Okay, next. Face me this way, please. March in place. Close your eyes. Should feel a little different. Okay, nod your head up and down. Keep marching. Stop marching, keep nodding. And stop to where you feel your level. Nope, still gotta do your Alice. There you go, sir. There you go. Let the stomach relax. Good. There it is. That's it. Gotcha. Walk it off one more time. Not dizzy from that, right?
No.
What's different right now as you're walking generally?
It feels a lot smoother walking.
Lighter,
Yeah.
lighter, smoother.
It's even from that, it's like a rush back to the head. But
Good. Have a seat back over here. Let's retest. There's still heat there. It's not a break, but there's still heat. I need you to do lots of icing here. Okay, and up here. Low back is optional. Okay, let's go left side down. Last piece of the puzzle to get started is going to be that pelvis. Look straight ahead for me, please. I got you the whole way, okay? I got you. I think. There it is. Shoulder needs to go up. There it is. Walk it off. I didn't touch the knee today, okay? I wasn't planning on it. Walk up on your toes. The knee should be feeling a little different already.
yeah.
Walk on your heels. Come right back over here, sir. Feet together. Open and close. Left side only. Cool. Right side only. Do you feel that now?
Yeah.
Yeah. Left side only. It's not going with it as much as it was before. Now let's check the motion. This is the top of the joint. This is the middle of the joint.
I don't feel it.
What's that?
I don't feel it.
Nope. And it's moving. All right, dude. That's where we're going to start with you.
Right.
L5, right pelvis. T6, C7, C1.
It's a lot.
Yes, it's a lot. I think you should be able to handle it. Squeeze now. Tell me how that feels there.
Go just a little bit still.
Tiny bit? Let's finish it up then. Ulna, posterior. There. Ulna. Let me have it, please. There. Go like that 5 times. And a little buff and polish. Just to break up any scar tissue. Squeeze. Solid. Let's do the ears for your balance. Turn around, face me. Homework. Water walking in ice, and you can start it on the one-legged stands. 2 minutes each leg. Eyes open. Tell me about the eye now. Turn. Bend.
It's not no vision going this way.
Before it was.
Straight.
So
When I
now-
see it straight, it's look vision at times, but now straight's not there. It's just
To the side.
to the side.
Okay, and that's what we'll need to sort out and figure out on the x-ray.
Okay.
So I will have Jeanette sort you out.
All right. Thank you.
Welcome to the office. Questions?